the America's Heroes Group Roundtable live stream digital media show. Today is Wednesday, November 13th, 2024. November is Military Family Appreciation, National Family Caregiver, Prostate Cancer Awareness, and Alzheimer's Disease Awareness Month. Happy belated Veterans Day. Veterans work every day, 365 days a year. They're never off the clock. I'm your host, U.S. Army Flight Surgeon and Iraq Combat Veteran Medic, retired Colonel Dr. Damon Arnold. And I have a special guest with me today who's written an incredible article that I had a chance to read. It's Stephanie Armour. She is actually a senior health policy correspondent for the Kaiser Family Foundation, KFF, a nonprofit foundation that does research, journalism, and communications programs. It focuses on major healthcare issues in the United States. She has reported on the Affordable Care Act, Medicaid, Medicare, COVID-19, abortion, and how politics and regulations in Washington, D.C. affect patients, providers, and the healthcare industry as a whole. She has previously worked at the Wall Street Journal, Bloomberg, USA Today, and Des Moines Register, and the Daily Tribune in Ames, Iowa. She is a graduate of the University of Minnesota. She has multiple journalism awards, and I can't, Stephanie, I don't know how you get the time in the day to have done all this. You look like you're 19 years old. It looks like you've done 100 years of work already. But let's get to your article. Your article is really fascinating. It really gripped me when I started reading it. And I think it's really very, very timely. Trump's White House Return Poised to Tangle healthcare safety net. That really is a very, very good description. I really encourage people to go to the KFF News, Health News site and make sure you read this. This was Stephanie Armour's article of November 6, 2024. So as we lead into it, there's so many questions I have for you, but I'll just turn it over to you and tell me what your major thrust for doing this article was. What was your incentive for doing this?
Well, I think we've kind of been looking for some time as to what return to the White House might mean for healthcare under Trump. And a lot of it's hard because the one thing you can say about Trump is you can expect the unexpected, right? So it's a little bit like reading tea leaves. And one of the things that we had noticed was if you talk to people who are in the Trump camp, on the transition team, or even people who worked with Trump during the last tenure, who especially in the healthcare arena, there's some pretty strong ideas about what he might do, especially when it comes to sort of the safety net programs. So it was kind of, the idea was, let's just look at what possibly could happen, what people close to him are talking about or would like to see happen. So again, it's anyone's guess, but these are some people who are pretty close to these topics and have worked on them during the previous Trump term. So I think what we're looking at is at least pretty in the realm of likely. But again, it's always hard to know.
That Robert F. Kennedy Jr. might be playing a pivotal role with public health. Yes. And that's near and dear to my heart. I was the former director for the Illinois Department of Public Health. And I wonder, what do you think the implications are for our public health system? Because there are multiple portions of this about affecting the healthcare system, safety net, as you were mentioning. But what about what his role would be?
Mm-hmm. That's a good question. He has certainly said that he was going to have a very strong role. Trump himself has said going to kind of let him do what he wants to do in this realm. And RFK Jr. has obviously have some very strong and sometimes unorthodox health views. The Trump campaign is also talking to others who are in the healthcare space that are very similar in terms of, how would you describe it? Maybe being a little bit more unorthodox or a little bit more critical or questioning of things that we have kind of taken for granted, like fluoride in the water or vaccines. So he's definitely tapping into that zeitgeist of sort of individuals who kind of felt like they weren't heard during COVID, if you were, or that they raised some questions. And I think this is really going to elevate a lot of those voices that maybe had been a little bit more on the fringe to much more mainstream dialogue and discussion. If RFK Jr. has very much wanted to look at the vaccines that children get and how often those vaccines are given. Trump has said he wants to look at that. So this is going back to some stuff that we have kind of taken as bedrock science in our society. So I think it's really going to be interesting to see where this goes.
Yeah, because it could be very dangerous. I'm a physician myself, and when I think about the time periods, I actually did some work overseas, about 2,300 countries in my time with the military, and I've walked through polio wards, overseas.
Yeah.
And the devastation that could cause, measles, rubella, whooping cough, just to mention a few of the potential threats to us. And I'm hoping that this does not get in the way of good scientific knowledge, as you were mentioning, and really tried and true public health interventions that have been saving people's lives. We take it for granted, even the fluoridation in the water, as you were saying, protects teeth, so children don't go to the dentist as much, less time absent from school. The parents don't have to take off to take them in.
Right.
So these things are really essential for us to have and to maintain.
And
But
I was
okay.
going to say, I do already see that the individuals who are close to the Trump and the transition team very much wanting to kind of remake other agencies like the Food and Drug Administration and nutrition science. So I definitely think you're going to be seeing a lot of activity in that arena too.
Yes, and that could be quite dangerous. And what I'm part of the problems that I have too with it is that enmeshed in this whole thing is the idea of deregulation. If we've gotten to the point where we start talking about having high fructose corn syrup in products, and and sort of trying to eliminate things and move in a healthier direction. And with the deregulation, I'm not sure of what that's going to portend for people that are shopping in stores just for regular foods for their children and for themselves, and whether that's going to have a health impact itself. But then that goes back into the issue about healthcare in the nation. So you were mentioning also that this might affect the Affordable Care Act as well.
Yeah, I think quite significantly, and I think that to me is kind of one of the big question marks, because former President Trump has said he doesn't want to repeal the ACA, but he has also said he had concepts of a plan, and there's a lot that could be done to undermine the ACA pretty easily by a new administration. For example, there are these people on the Affordable Care Act, they get subsidies, most of them, that help reduce the cost of the monthly premiums of your health insurance. And these subsidies have been expanded, more generous to more people. And those expanded subsidies are due to expire next year, the end of next year. So one thing that the incoming president could do is simply make sure Congress doesn't bring it up again, as just simply do nothing and let these tax credits and subsidies expire. And that would cause significant premium increases for millions of people on the ACA. So I think you could see things like that happening pretty almost by not doing nothing, but by doing nothing, basically. Simply letting them expire would have a huge impact. Other things we've already seen him do when he was previously president was cut millions of dollars from outreach and navigators to help people sign up for these ACA plans. I do think we're likely to see some of that happen again. The question is, how far will it go? Like, will there be an effort to basically repeal the ACA without calling it repeal? Will the steps that they take be enough to kind of dismantle what is there? And it is certainly possible, if there has been some talk about letting people use these subsidies to buy plans that don't comply with the ACA. And if that starts to happen, you're definitely going to see kind of the dismantling of the law, because these plans that don't comply means that, for example, you might not have protection for pre-existing conditions. So I think the people I'm talking to, the health analysts, are like, we are watching. We are waiting to see where this is going to go next, because I do think some changes are really likely in the ACA.
That's very disturbing, and it reminds me when you were saying that, I was thinking about the old legal term, caveat emptor, buyer beware.
Yes. Yeah.
What kind of future are you buying for yourself? And if they do that, then people who potentially are covered right now for catastrophic injuries, or for the children who have developmental disabilities, those types of things may be removed from the plan. I don't know, but they may end up losing that coverage. And the reason why the ACA was actually put into place was to actually offset what was going on in the general market. That insurance was just too high for people sometimes. If they were at or below the poverty level, and unfortunately, that's a sizable portion of our population, as a nation. And you was mentioning also that the current uninsured rate might actually increase, right? It was about 8% now.
Correct. Yeah, I think it did go up by a couple million during Trump's last tenure. So I think the broad perception is that we're going to see that increase. But I think what might drive a lot of that is not just the premium subsidies that could kind of winnow away if they're not re-upped by Congress, but I think that Medicaid is definitely going to be in the crosshairs, because Trump and Republicans very much want to extend tax breaks that are due to expire next year. And I think they're really looking at Medicaid as a way to cutting funding for Medicaid as a way to provide some money for those tax breaks. So I do think we're going to see some potential big changes to Medicaid, whether it be how Medicaid is funded, which would likely require Congress, or whether it's just going to be cutting back on benefits or money, or imposing work requirements. I think we're definitely going to see some big changes there.
Yeah, and one of the things, as a physician, as I mentioned before, we have an increase in obesity, those kinds of things, in people who are younger, and those people who are now covered until the age 26 may be affected as well.
Yes.
So we do see illnesses occurring much earlier in life than they normally would, as far as historically, So
Yeah.
that's another issue.
Well, and it's true. That's what also is interesting. You brought that up, because that brings it right around to that whole issue of public health. Because one of the things that I've been really struck by that former President Trump has focused in on is chronic disease issues. If you watch some of his videos on his campaign site, he's very much talking about chronic disease, which in some ways is great, because we as a nation have not focused enough on the fact that our life expectancy is going down, despite how much we're spending. But I think that's what we're going to see a lot of grappling with in this new administration, is tackling chronic disease. And how do we do that? And do we kind of look at some unorthodox things we haven't considered? We're going to see a lot of ideas that are going to be new, and I think challenging to conventional wisdom, which will be fascinating to see how that goes. But I do think just what you're talking about in terms of how many of our people in our country are dealing with issues like obesity and chronic disease, that is something that I think whoever heads the new HHS will be taking up.
Yes. And, one of the things you mentioned also was that Brian Blaze, basically said he'd see a building on the first term from Trump's first term. And I'm wondering, it's minimizing fraud and waste. And of course, that, in any governmental institution, you have to have an eye on that and make sure that you're watching for fraud and waste. But there's an underlying theme of deregulation and getting rid of the whistleblower protections and all those things. So I'm trying to figure out how this thing works in my head, and it doesn't make much sense to me. But what about the minimizing fraud and waste? What do you see from that perspective? I'm not sure if it's really as large as they say.
Well, that's a really good question, and I'm glad you brought that up, because it can kind of cut two ways. On one hand, yes, we don't want to see fraud and waste, and there's some health analysts, especially conservative health analysts, that have been looking at some of the programs like the ACA and saying there's a lot of fraud, people getting subsidies that shouldn't be. And so, yes, cutting down on fraud and waste is important, but it's also can be tricky because that can also sometimes be a cudgel for weeding people out who should be getting these programs and entitlements. So it's kind of a slippery slope, and it'll be interesting to see how that plays out. Like, how do you ferret out fraud and waste without necessarily coming down too hard and accidentally ousting people from programs? And that's kind of where I think we're going to have to watch and see what happens.
Yeah, I was wondering, in the background when we were talking about the vaccinations and immunizations, that type of thing. In the background, you also have an industry that provides those, medicinal things that we need for, inoculating people, the syringes, all those kinds of things. And I'm wondering what their backlash is going to be when they start hearing that we're getting rid of vaccinations, that there's a hallmark or a central feature of what they do to try to protect the public.
Well, it's interesting. And I could be wrong on this, but I was talking to some individuals in the pharmaceutical industry, and I don't know how much the companies make from the vaccines that are out now. It's really more like these new blockbuster drugs. So I don't know how much that's going to hit them in the pocketbook necessarily, but I do think there's definitely going to be a big reckoning with, quote, big pharma. I mean, one thing Trump has shown during his last tenure is he is fine taking on the pharmaceutical industry. He's certainly tried to do that he had this favored nations idea that we would pay in the United States for drugs the same lower prices that they pay overseas in Europe. And that was something that the industry did not want. So I definitely think in that realm, that's an area where he feels pretty comfortable being pretty forceful. So I do think that the industry is quite worried.
Yeah, and one of the things that you mentioned was Leslie Dosh, who is executive chair of Protect Our Care. She said they're going to raise costs for millions of Americans and rip coverage away from millions. And meanwhile, they will give tax breaks to rich people. And it sounds like, we start having a medical caste system or a class system that's arising in the country, because it was kind of interesting to me. I remember when Donald Trump actually had COVID, and he was telling everyone not to get vaccinated, not to take this medication, and then he ended up taking them and becoming vaccinated. So I'm wondering if that is something that people in the general public have to be aware of, that you may be unable to obtain something that other people who have a little bit more clout, a little bit more money may be able to get.
Yeah, I mean, I definitely think there's real threats to things like IVF or potential vaccines. I think that that's legitimate, just in terms of some of the individuals I'm talking to, that they would like to see less access. So I do think that's possible. I also think that one of the things that the former president has tapped into is, I think that COVID, that whole pandemic, caused a real lack of trust in our medical institutions, which is ironic because there was such an effort to build up trust around the whole vaccination push. But I think in essence, it's left people with a lot of distrust. And I think that may be fueling some of this whole focus in this new administration on chronic disease and revisiting some of the long-held tenets of medicine and science. And I think where that goes is really going to be worth watching. It's really going to be important for our nation, actually, in terms of what we do and where we go with this.
Yeah, and one of the things that also you were mentioning that the Inflation Reduction Act, actually of 2022, August 2022, when he signed it, it seems that Inflation Reduction Act extended some of the benefits under the ACA subsidies, and I'm wondering, the Biden administration has lowered the price of insulin, capped it, and then also had 10 other medications that were on the runway, to have price, a little bit of a price fix on it so that it doesn't really hit the pockets of people. I'm wondering, is that going to go away?
That's impressive. I'm just like, yeah, you know this stuff well. That's great. But the individuals that I'm speaking to on the Trump team, a Trump transition team, have told me that, so this is only what I'm hearing, but they've told me that he is very much in favor of the price negotiation in Medicare, but he would be willing to revisit it if the industry can come up with something better, whatever that means. So does that mean price negotiation will stick around in Medicare? Maybe, maybe not. But I think what they were saying is that this idea he's going to come in and right away get rid of that, despite his opposition to the Inflation Reduction Act. I don't see that happening, but I don't know. But you're right. That is definitely another thing to watch because that really is supposed to drive down costs. And it is not something a lot of Republicans like, is the drug price negotiation.
Yeah. And I wonder, what do you think the effects are going to be on the Medicare and Medicaid services? Because that is part of HHS, Health and Human Services. And, it's actually administered through the states, but the funding comes from the federal government. And,
in Medicaid, it's state and federal. And I think there's some talk about like looking at the actual way that Medicaid is funded. In some ways, one idea is to put like right now it's open-ended, like the federal government keeps paying as the states pay. One idea is to cap it, like the federal government will only pay this much, which yes, reins in costs, but can lead to fewer benefits, fewer people enrolled. And I think that there's going to be a real look at maybe changing some of that on Medicaid, which is going to definitely be worth watching. Trump kind of tried to do that previously, but through state waivers. And I also think Medicare, one thing you're hearing some talk about is having people automatically enrolled in Medicare Advantage plans when they are 65. And the interesting thing to keep in mind with that is Medicare Advantage they're run by private health insurance companies. So ostensibly, if that does come to pass, which is something a number of conservatives want, it very much would be sort of a privatization of Medicare, for good or bad. It would be a real shift in the program.
Yeah, because I remember the days my mother was a social worker. She had passed away when she was 91 years old, knocking on people's doors 2 weeks before she passed away. I mean,
wow.
Incredible. But she always worried, that these seniors who are under Medicare and Medicaid, that they wouldn't be able to afford their medication. So they actually had stories of people eating dog food, right? I mean, they save the money in order to buy their medications and make sure they have that. I hope we're not heading into a disaster zone right now for those people who are senior citizens. And, many of our veterans who are out there, they have family members taking care of parents, or they are seniors themselves. And to treat them like that would be abominable.
Well, and I will say Trump has said that he will protect Medicare. But again, it's how that plays out. I just don't know. But there are some real concerns about should Medicare Advantage become the de facto, what that would mean, because a lot of those companies that run those Medicare plans have a lot more pre-authorization requirements. For example, may decline to cover something which you wouldn't see with your traditional Medicare. So that's kind of the risk is in that area.
Yeah. And one comment you were making was that Medicaid will be a big target in the Trump administration. Larry Levitt mentioned that. So I was wondering, so Medicaid, I can see being a target because, the far right side says, Medicaid is a handout, a government give out, and that kind of thing. And I remember, an interview that was done earlier, in Alabama, was way before the first presidency for Trump. And they were mentioning that we have a issue, with one person had a hip replacement, and they said, "Well, don't you believe in Medicaid?" And they were on the sort of far right side, and they said, "No, no, I don't think Medicaid's a good thing." It's well, you got your hip replaced by it, right? Oh, but it's only one time.
Right,
So,
right.
so, they're playing a little bit of a background music, so we have a little limited time. But I want you to come back on, because the Comstock Act is really going to play a role down the road as well, because of the issues about abortions. We still have that problem, and we're going to have to see how it plays out in the states. Some women have died, and some have suffered the consequences of not being able to seek care. Doctors are afraid of being thrown into prison for life, for helping someone. This is just it's just a really unsettling situation for those who are practicing medicine right now. If anything you want to say, one last thing you want to say, and then I'm going to bring you back on. You have to come back
I would
on,
love to.
Stephanie.
I think that I would just say expect the unexpected. That's kind of the rule of the road. I think a lot of reading a lot of the tea leaves, I think we're up for some really big changes, but I also think changes in ways that we haven't considered, like what it's going to mean for public health and some pretty basic things like vaccines.